Welcome to Live Calm by SOULESTA Living, the podcast where each week we explore practical ways to bring calm to your mind, body, home, and relationships, the four pillars of my Calm Compass framework. I'm your host, Keeley Cherie, calmness coach and founder of SOULESTA Living. So whether you are an entrepreneur, a busy professional, someone just ready to prioritize your peace, this podcast is your guide to living your best, calmer, healthier, and happier life. So let's dive into today's episode. Today's focus is on the body, and we're talking about unconventional and conventional ways to support your heart and help you feel your very best self. So this month happens to be American Heart Month, and this is a good time to focus on your heart health, something that is very important that affects us all. So I am very passionate about heart health. One, because my best friend passed away in her 20s from a congenital heart condition. And two, because I've had my own very scary struggles with my heart health. And I'm going to share some of those stories in this episode. So I want to start by saying that I'm not a medical professional, so I'm not giving any medical advice, but I am simply sharing my experiences in hopes that it will help someone, and then you can follow up with the appropriate medical professionals after you hear the details in this episode. So I also wanted to share at the beginning some heart-related statistics from the CDC. So that is the U.S. Centers for Disease Control and Prevention. So heart disease happens to be the number one cause of death for both men and women in the U.S. Someone in the United States dies from cardiovascular disease every 33 seconds. And every 40 seconds, someone in the US has a heart attack. And around 1 in 5 heart attacks are silent, meaning that the person may not have experienced any symptoms at all. Someone in the US has a stroke every 40 seconds, and it is the fifth leading cause of death. And about 6.2 million adults in the US have heart failure. And those statistics are just beyond unfortunate, even just doing the research and seeing those statistics. So that's why it's so important to equip ourselves with knowledge to be able to do what we can to improve these outcomes. So what I'm going to share is to try to go beyond some of the usual advice and discuss some of the lesser known factors that could be affecting your heart health. So like your sleep quality, food sensitivities, deficiencies, and even your oxygen levels. So first, we are going to start with sleep apnea and the effects on your heart health. Um, so according to the National Library of Medicine, 80% of sleep apnea cases are undiagnosed. So that means 80% at least of people who have sleep apnea don't know they have it. So this was me maybe 2 years ago because I was just diagnosed very recently. So, sleep apnea is linked to heart attacks, high blood pressure, heart disease, stroke, and other cardiovascular issues. So, you might be wondering what exactly is sleep apnea if you're not familiar. So, it is a sleep disorder in which your breathing stops repeatedly. And starts throughout the night. So when this is happening and your breathing is stopping repeatedly, your oxygen level drops, which is also known as hypoxia. And that puts stress on your heart and your blood vessels. So There are two main types. So that is obstructive sleep apnea, and that is the most common type. So typically, people with obstructive sleep apnea, um, they're having relaxation in their throat muscles, and that is blocking their airflow. So I have obstructive sleep apnea, but for a different reason. So um, when I was born, it seems that my jaw and mouth did not fully form. I know you can't probably tell just by looking at me, but I have really small ears, and so that also is an indicator that everything didn't grow properly to like the fullest amount that it should have. But my tongue still developed to the normal size. So my tongue is out of proportion to the size of like my jaw and mouth. So how I discovered this, because I did not know, but apparently to doctors, I've had sleep apnea my whole life, likely because of genetics, basically, and the anatomy of my jaw and mouth and tongue. But I first was diagnosed with TMJ, which is like inflammation in your jaw joints and area. So when you have TMJ, they don't recommend you sleep on your sides because you can aggravate these areas again. So what I ended up doing was I then started sleeping on my back because I thought I'm not supposed to sleep on your sides. And all of a sudden, I started having um, crazy night terrors. I just had this overwhelming feeling that I was going to pass away in my sleep. It was strange. It was like really severe anxiety related to my sleep. I would wake up constantly throughout the night, gasping for air. I would be disoriented in my room. I really was really nervous. I was having early onset, like dementia or something because I would not recognize where I was in my own bedroom. I would have these episodes where I would jump up out of bed, like onto my feet, and go to the bathroom and look at myself in the mirror. And then I didn't know how I got there or why. And I didn't know what was going on or what triggered that to happen. So I was also having some other health issues at the time, and I saw a neurologist and I was explaining to him some of these other symptoms that I was having. And he's like, "Oh, well, simple. You're experiencing all of that because you have sleep apnea." And I'm like, "How do you know that?" And he's like, "Oh, just by looking at you and looking at the size of your tongue and something that I've had my whole life and did not know." He was able to diagnose right like that. So some of the things are not just on the surface level of, oh, I don't snore, so I don't have sleep apnea. No, you really need to be looking at your numbers, looking at how you're feeling from day to day. If you're having some of these focus issues, memories issues, things like that that are coming up. The other well-known type is the central sleep apnea. And so that is a little bit less common, but that is where your brain is failing to send the correct signals to control breathing. Um, then you could also have increased sympathetic nervous system activity. So when you have sleep apnea, that is triggering your body's fight or flight stress response, and which is going to increase your heart rate and your blood pressure. And then it is also triggering an inflammatory response. So, sleep apnea is associated with increased inflammation, which is a key factor going all the way back to heart disease. So, what are some symptoms to look out for sleep apnea? So, I mentioned some of these a little bit ago, but the number one that people look for is loud snoring, and they think that if you don't snore, that you don't have sleep apnea, which is 100% not true. I don't snore, and I have sleep apnea because of what mine is connected to. It's not so much of like a sinus issue. Mine is more of a tongue issue. If you are gasping or choking during sleep, if you have someone who is sleeping next to you in the bed, you could have them observe you. Are you having morning headaches? I was not having morning headaches. It was more like dizziness, not as much of headaches. Many memory issues or disorientation. So that was the story that I shared that really triggered me because I was having very abnormal thoughts and experiences and not able to focus, remember a lot of things during the day. And then there's also high blood pressure. You're having these blood pressure spikes, which I also noticed. So, how can you get diagnosed? Um, Again, it's important that you see a doctor or a sleep specialist for your specific issue and get treatment for what you're specifically dealing with. When I shared this, a lot of people automatically said, "Oh, you should have a CPAP machine." That is not recommended to me by my doctor because a CPAP machine for me would actually make my particular issue worse because it would push my tongue backwards instead of pulling it forward, which is what I need. So there was a different device that was recommended for me, and there's some other different ones out there. Um, so I would recommend starting with your primary care doctor and having them refer you out to a specialist, someone that they recommend, and share that information back with them as well after you go to the specialist. And I also recommend talking to every doctor you have. I have a lot of doctors. I have a hematologist as well, but they all need to know exactly what is going on with you because they're all looking at the same issue from different perspectives and have different knowledge. So, another doctor might be able to give you different insight. Like, I would never have thought that I would have been diagnosed by a neurologist because that's not really what they do. So, but I was glad that I at least shared what I had going on so he could give me his feedback. And then you can also do a formal sleep study at a sleep clinic to get a diagnosis and more information as well. So I hope this helps for you all increasing your awareness around sleep apnea. Next, I'd like to talk about low oxygen levels and the effect on your health. So, again, low oxygen is also known as hypoxia. And so, this could be while you're asleep or when you're awake. And whenever it's occurring, it can put stress on your heart. So ideally, your blood oxygen levels should be 98%, but even 95%, I've heard from doctors, is still good. But if you're dipping into the 80s, 70s, that level of percentage, that is when it's time to see a doctor, maybe run some tests and see what could be causing those oxygen drops. So, what are some common things that might cause oxygen drops? So, again, sleep apnea could be a cause when you're blocking that airway. Asthma, if you have that, pneumonia, high altitudes. So this is something to be aware of. So I just came from a trip to Arizona in the mountains, and this is something that I've also shared with people who are traveling to places like Colorado. Any of those places you have to be aware and make sure you hydrate yourself. There's also cans of oxygen that you can use. You can get them from the store. They sell them at CVS to help with those oxygen drops. Also, anemia, which is an iron deficiency that impacts the ability for oxygen to travel through the blood. B12 or folate deficiencies, also shock, which I have experience with. I was wearing my oximeter at one time when someone really scared me, frightened me, and my oxygen levels dropped really low. And so I could trace it back to that moment. Also, alcohol can impact your oxygen levels and can drop them as well. And I'll talk a little bit more about this in a minute, but food sensitivities and inflammation just in general can impact your oxygen. So what can help is using a pulse oximeter at home. So I wear one every night. I wear it on my thumb, and it has been super, super helpful. So you can catch the issues in real time or monitor as you're sleeping because it monitors continuously, and it has an app where you can go back and look at the data. You can also it is able to be used by multiple people. So when I have guests and people, family, friends come stay with me, a lot of times I'll have them wear the oximeter overnight so we can see what their oxygen levels are, what it's looking like. Since most people aren't tracking it, I try to expose people to doing that on a regular basis. So this is also helpful if you have any moments where you might be experiencing dizziness, fatigue, shortness of breath, or you just feel off. A lot of times, if I feel off, I will put the oximeter on really quick just for a minute, just to check in and see where it says my levels are, to see if there's anything that I need to be concerned about in that moment. So I will share the link in the show notes to the oximeter that I have. And so it is called the Well U O2 ring. It also will buzz me. You can turn this on and off in the app if you don't want it to buzz you, if you want to sleep through the night or have it on without it buzzing you. But I have mine set just in case when I'm sleeping, if I accidentally end up on my back and my oxygen is starting to drop, it will buzz me below a certain amount. Also, if my heart rate is increasing or decreasing to a low level, it will also alert me with that as well. This has been so invaluable also when following up with your doctors. Like I have been to urgent care and the ER a couple of times dealing with blood pressure spikes and oxygen drops and things like that. But sometimes by the time you get to the doctor, you might have stabilized and maybe you were doing something in the moment that triggered that reaction that's no longer happening when you get to the doctor's office or the ER. So they don't really have any reason for what happened. But if you can have the data to show them, which I have had to say, okay, look at how, this drop happened at this time. Okay, what were you doing at that time? Maybe this was triggered by a certain activity. Like I just heard recently, even having your hands above your head, if you're dealing with circulation issues, like I do, having your hands above your head, even prolonged periods of something simple like doing your hair can trigger certain responses, which I'm newly learning. So when you see a medical professional, they can recommend to you what you should be doing if you're having any challenges like that. So I hope that was helpful in learning about tracking your oxygen levels. That's so important, and heart health. And next, I want to share on nutrient and mineral deficiencies and your heart health. So, your heart relies on nutrients and minerals to keep a steady heart rhythm and to have your heart function properly, basically. So, potassium is critical for your heart rhythm. A lot of people don't know that. And pressure regulation. So, about a year ago, I was having some challenges and went to the ER. And when they did a study or test on me, I had low potassium. That can really affect your heart because it again, regulates your heartbeat. And I have known of other people who have had really bad issues, like have been hospitalized because of low potassium. So make sure you are staying on top of your levels. Magnesium is essential for the electrical signaling of your heart. Selenium, that is important. It's an important antioxidant for your heart tissues. Zinc supports your heart muscle function and the repair of your heart. And then copper is critical for collagen formation in your blood vessels. So I would not recommend just taking a bunch of supplements without knowing exactly where your levels are and what you need to supplement with. So I would recommend seeing a medical professional and getting a blood test and having them recommend to you what dosage you should have based on where your levels are. And then next, I'll be talking about food sensitivities and heart health. So I did an entire episode on food sensitivities. That is episode 2, if you want to go back to that one and listen. But food sensitivities, they cause inflammation over time, and you might not notice them right away. And they're different in this way from allergies, whereas allergies cause like a quick, acute reaction right away. So heart disease is viewed as a potentially inflammatory condition, and inflammation is linked to pretty much every disease and most health challenges that we have. And so from my research, again, not a doctor, but from my research that I have found, inflammation can impact the blood vessels and cause them to shrink. And then that puts extra stress on your heart. Another thing I feel like is overlooked is your oral health and the heart connection. So think of your mouth as a gateway to your whole cardiovascular system. So the American Heart Association reports that people with gum disease are 2 to 3 more times likely to suffer from heart attacks, strokes, and other cardiovascular events. So if your gums are unhealthy, they are allowing the bad bacteria to access your bloodstream, and that is wreaking havoc on your heart. So the Journal of Periodontology published research highlighting how the inflammation caused with the gum disease can trigger similarly inflammatory responses in the heart. So be sure that you're doing your basics of oral health. We hear this all the time, but really sticking to it as flossing daily, because if the food is stuck in your teeth and the bacteria is feeding on that food, that is what's making it worse. So that is one of the reasons why I had to have oral surgery a couple years ago, to have 8 of my teeth removed in the back of my mouth. Again, going back to what I shared earlier about my mouth size not developing properly, and my teeth were very crowded in the back of my mouth. And because it was so tight, because not a lot of space, it was very hard to floss in between those teeth. So doctors recommended it's better for my overall health to take all those teeth out. Because most of the time when I share with people I've had 8 teeth removed, they're like, oh my gosh, like why? And do you have any more teeth to like chew your food with? But it was really going to start impacting my overall health, leading to severe gum disease, because there was no way that I could always get in between my teeth to get, the excess food particles and stuff out. So that is why the doctors really recommended that I have that surgery, because it's better for me to lose those teeth versus having a cardiac event because of the teeth that I had. Also brushing twice a day, not just in the mornings, but also in the evenings as well, like before you go to bed. And then staying on top of your regular cleanings, because you're gonna, clean out all the excess gunk that you have, that can only be done, by a professional, like a medical professional. So just make sure you are staying on top of those dental appointments and paying attention to your oral health. Another thing I heard recently from a dentist is like rinsing your mouth out after you eat, like not necessarily always having to do mouthwash, but even just rinsing it out with water, that helps to reduce some of the like bacteria and extra food in your mouth. So that's a simple thing that I started doing recently while I'm at home. And then lastly, stress hormones like adrenaline and heart health. So I think it's obvious that stress in general can impact your heart. That's something that most people would, might guess. But I learned this in a real way a couple of years back. So I had an episode where my heart rate was just abnormally high, my resting heart rate, like not doing any physical activity, not walking, running, nothing. My heart rate resting probably should not be above like 100, but mine was really high. And I was actually visiting a gym to start meeting with a physical trainer, and he kept telling me over and over, I'm not a doctor, but because my heart rate was really elevated and we had not done any exercise at all. And so that really made me nervous again because my best friend passed away from a heart condition. So I immediately made an appointment to see a cardiologist, get all the tests, get everything checked out. And what that doctor told me really did change the trajectory of my life. So I am forever grateful to him because he had one of the most real conversations with me that I've ever had with a medical professional. Um, but basically, he told me that my heart was a healthy heart, but it was responding to the stress that I was putting it under with my lifestyle, with the way that I was living, with my work. I was a workaholic at the time. I did not have good boundaries or anything like that. And I was sharing with him because he was going over, which I didn't realize at the time, learning about my lifestyle and, the things that I did. And at the end of it, he said, you are suffering from an excess of, or an overdose. He used an overdose of adrenaline, which I didn't even know you could have. And so that is a normal hormone that your body produces. But anything that you are producing chronically, basically, where it doesn't stop, like similar to inflammation, inflammation is not a bad thing. It has a purpose in the body. But when you get to a level of it being chronic, where it doesn't stop that process, that's where your body starts having negative reactions to it. So that's what was happening with me because I was go, go, go all the time and not really resting and not really sleeping, all of that. I was pumping my system with adrenaline constantly, and the heart was responding negatively to that. So I was having heart palpitations. My heart was feeling like it was beating out of my chest. And he said, well, I can prescribe you an adrenaline blocker, but that's just a Band-Aid, basically. And what you really need to do is change your lifestyle. And I was like, oh, okay. Because most doctors like to just give you the drug. But this doctor said, no, you need to change your life. The problem is you. And that is actually how I got into wellness. That's how I transitioned into the wellness space because I was like, how am I going to do this? How am I going to change my life? And so the things that I started learning for myself, I became passionate about sharing with others. So there are a lot of heart health basics that you can do to, support yourself. But I'm just going to share a few. There are many, many more than this that you can research yourself, but I just wanted to share these few. and what I do. So eating a heart healthy diet. So first starting with fiber, a lot of us don't get enough fiber in our diet every day. So one of the things that I do to increase my fiber intake easily is using ground flax seeds. So ground flax seeds do not have a lot of flavor to them. So you can add them to pretty much anything and they don't have a strong taste at all. So I add them to my oatmeal at breakfast. Sometimes I'll add them to a pasta. Sometimes I'll add them, if I have something like with bread or whatever type of spread or sauce, like I'll just add it on top. Or sometimes we don't all eat 100% healthy every minute of every day. I'm an everything in moderation person. So if I am having something sweeter, like say I'm having a cinnamon roll for breakfast, which is not often, but every now and then I might, then I might sprinkle the ground flax seeds on top of it to at least be getting something nutritious in it. Not that it's going to cancel out the sugar, but at least to add something to it. So, but again, going back to the inflammatory foods, I wouldn't recommend just starting it if you don't know if flax seeds are inflammatory for you, but they aren't for me. They're not on my inflammatory list, but another high fiber food is kiwi. It's funny because my name always gets mixed up for that all the time, but I actually wasn't eating a lot of kiwi until recently, until I realized that kiwi is like a superfood. It has more vitamin C than oranges, and it has a good amount of fiber. So it's really good for you to eat daily, again, if not in your inflammatory list. Then having healthy fats, lean protein, omega-3 rich foods like salmon, nuts, seeds. And again, as we all know, not eating as much sugar or processed foods. Next, moving your body. So there have been times when I have, had certain episodes and I'm like, oh, you're afraid of, exercising too much because you don't know the impact that it's going to have on your heart and if you're going to stress your heart out. But actually, with exercise, it's the opposite. So it actually strengthens your heart muscle. So even if you're doing something simple every day, like for me, I try to take a sunset walk every day and or climb stairs, like simple stuff like that. No, it's not always like a hit exercise, like the high intensity workouts and all of that stuff makes me feel dizzy and does not work for me. So I do the type of exercise that I can do that works for me, that I can be consistent with every day. So I recommend the same for you. So if that is yoga, I have chair yoga classes available, or whatever type of exercise that gets your heart rate pumping. Then monitor your blood pressure and cholesterol. So I actually have a blood pressure monitor myself that I keep in my car, because I had an episode when I was driving once. And so I had to stop and go to an urgent care to check my blood pressure to see where it was. And from then on, I decided to keep my blood pressure monitor in my car. And that has been useful even for other people. Like other people I've been around have had episodes, and I have had a blood pressure monitor in my car and have been able to be with them as they're trying to work to bring their blood pressure down. So, again, going back to knowing your numbers, knowing what's happening inside your body, having these tools with you, even if you consider yourself a young person, healthy person, all of that, but it still doesn't hurt to have these tools available to you. Um, and then another tip, we all know this, smoking and alcohol can impact your heart. So smoking is one of the biggest impacts or risk factors for heart disease, as well as alcohol intake. And alcohol can further dehydrate you, which can also make your heart rate and blood pressure and all of that go up. So that's just something to be in mind. Not telling you what to do or not to do there, but just something to be mindful of, like if you are smoking or drinking alcohol. Um, Prioritizing quality sleep. So whether you have sleep apnea or not, it's recommended you get 7 to 8 hours of quality sleep per night that you should be aiming for. So you can try to have a wind down routine, something that helps your brain like get in the mode for sleep. Making sure you're avoiding too many screens and like the bright lights and everything that can impact your sleep before bed, and trying to have a consistent sleeping and waking time each day so your body gets used to that rhythm. And then I would also recommend, I think I mentioned this earlier, but again, visiting your primary care doctor, or your cardiologist to know where your heart health stands. I keep a tracker of all of my different symptoms and things that are happening, because sometimes when you're doing checkups with your doctor, you might forget some of the things, like, oh, when I recently went to the doctor, they said, well, have you had any chest pain on the left side recently? Well, I actually did. And I had that in my notes of which days I was experiencing those things and what was happening at that time. So I just keep a log in the notes on my phone. So I recommend that you do that as well. And then the last tip I have is to follow the American Heart Association on social media for more tips. So their content is very trendy, very current, while also being educational at the same time. So at the time that I am recording this, they have songs that have the right beats per minute to perform hands-on CPR, from artists like Bad Bunny, Beyonce, Kendrick Lamar. So they get people's attention with that and it works, but it's also information we need to know that could save somebody's life. So shout out to the American Heart Association. Go follow them on social and stay up to date with all of their great heart health tips. So I hope you learned something about heart health today, from what I've shared with you, that can be useful to you or somebody that you know. If you are interested in diving deeper, you can get my Self-Care for Your Body collection, and that covers healthy and mindful eating, exercising with ease, staying hydrated, better sleep, using healthy body products, as well as intentional medical health checks. So it has a PDF guide that goes with it, a workshop replay recording, and there's also a body appreciation and self-love meditation included in that. And so now it is your turn for the Calm Connection corner. So I would love to hear from you, in the ways that you keep your heart calm, and any tips you might have to share with anyone else. So you can tag my social media page at Soulesta or SOULESTA Living, or email us at soulesta@soulesta-co.com. And for any organizations listening, this is also very important for your employees, because if they are not managing their heart health, they're not being very productive at work, which is directly impacting your bottom line. So something to share with your employees as well. Right. So thank you all for joining me on this journey to living calm. If you enjoyed today's episode, please subscribe so you never miss an episode, and share with someone who might need more calm in their life. So I want to grow this peaceful community together. If you're wondering where to start on your calmness journey, I have got you covered. You can take my free Calm Compass quiz to discover which area of your life, whether that be the mind, the body, the home, or relationships, that needs the most attention right now. So it's quick, it only takes about 2 minutes, and it will help you in taking the first step in living a more peaceful life. So you can visit SOULESTALiving.com or the link in the show notes to take that quiz today. You can also leave me a review, a comment, or email us at soulesta-living@soulesta-co.com to be featured in the Calm Connection Corner or a future episode if you were inspired by anything you learned from today's podcast. So remember, just like my grandmother Celesta taught me through her famous lemon cakes and her resilience that inspired Celesta Living, that when life gives you lemons, make lemon cake. Sometimes the sweetest moments come from embracing life's challenges with joy and grace. Until next time, live calm and well.